our master facilitator, and Linda is also there. I'd like to welcome Caroline Hollins Martin to Virtual International Day of the Midwife 2015. Caroline is a Scottish trained midwife, originally from Glasgow, and is a professor at Napier University in Edinburgh. Caroline has been a midwife for 30 years and has worked in a variety of roles for 11 years and has been an educator for 19 years in a number of universities across the UK. Caroline is not only a registered midwife, but also a psychologist, and her research interests include obedience, hierarchies and how they influence choice and control for women. And Caroline also created a birth satisfaction scale used in 27 different countries. So thank you, Caroline, for coming to talk to us today.
You're welcome. Okay, what I would like to talk today about is the therapeutic effects of music in maternity care. This is an area that's really quite under-researched, although it's not going to look like that when I present a lot of studies to you. I published a paper which has looked at all the papers that have been published in the area of maternity care, and my conclusion is that midwives should be using music to help make birth a much more satisfying experience, and also to do with bonding of mother and baby, and the benefits for neonatals in the special care baby units will become evident after I've spoken to you for a while. So really what I want to talk about in this presentation is music and its meaning in terms of feelings and associations. First of all, to emphasise and make the point, because when I've raised the topic of music and it's used to help make people more relaxed, a lot of midwives will say, well, I'm not really sure why this is important. Is this not something that's just part of everyday care? Well, the answer is it possibly could be used much more effectively than it is being at the moment. And for me, this is just a new area of interest, and what instigated my interest was I was working as a professor in midwifery at the University of Salford in England for 3.5 years, and it has a very large music therapy department there. And I hooked up with one of the doctors in that department, and he convinced me of the benefits of music. And it was being used in the paediatric wards in Manchester hospitals, both to entertain and give children a better time while they were sick. And he had a very successful impact on that for me, and I'm now straying into a new area of work that I would like to go into. But really, for the people that are listening, whom I see are 44, what I really would like is at the end of this, if you could tell me if you see the benefits of this, and what we should be doing as midwives to use it in clinical practice. Okay, so the basic of music therapy courses tell us that music is highly effective at influencing mood and associations. Also, from my own personal experience, I'm a bit of a music follower. I've seen many bands across the years. I'm a person that listens to music the majority of the time, at home, in the car, when doing my housework. It's something that brings me a lot of happiness. So from personal experience, I like it, and that is really key. What the research has shown is key. Not all pieces of music will work for everybody, and the key is the piece of music that somebody likes and enjoys. That's where you get a good effect. And in terms of midwifery research and obstetric research, I can speak for the UK here. The focus of all the government grants and projects and universities and so on tend to be focused on mortality and morbidity in terms of death, maternal death, fetal death, and morbidity problems that are caused. And I would say that music therapy is not fitting into any of these categories. And I think that's why there's so few papers written about this topic, because it doesn't lean itself towards current climate. However, that does not mean to say that the experiences of women are not important. They're very important, and now that we have got hard care in terms of mortality, and mortality figures pretty static actually in the UK, I think emphasis starts to shift onto soft care, and soft care is about giving people a better time, helping them enjoy the time they spend in the maternity unit better and optimise their experience. So they're evaluating it in more positive ways. So that's why I see music as being important, really in terms of measuring, has this person who's listening to music in a clinic waiting room enjoyed They're a bit more than somebody who has blank space. You know, somebody going for an amniocentesis, you know, having music played, has it made the experience through distraction or engagement emotionally a better experience for them, bearing in mind that they might be very nervous in a situation like that. And another key factor is music is virtually free. You know, it's not non-invasive and it seems to have highly therapeutic effects. So what I want to do now is demonstrate to you how music affects your emotions. And the first thing that I'm going to raise is the music industry and the movie industry have recognised this for a long time. Because, you know, if you know when you watch movies and so on, you can pretty well guess what direction that film is going into because of the type of music that's played in the backdrop of the film. For example, romantic music, or if it's a thriller, you know, you get the music, you know something creepy is about to happen. You know, so music in those contexts has been used to manipulate people's emotions. And I'm talking about manipulating women, childbearing women's emotions in a very positive way. If they don't like it, they don't have to listen to it. If they do like it, it might make them feel better. And these are things that need measured. So, what I'm going to do now is present some papers to you and just show you what these papers have said about the use of music in maternity care. Also, we need to be pretty clear, a lot of these studies could be heavily criticised in terms of systematic review, in terms of their rigour. And what I mean is sometimes the numbers are low, sometimes the variables aren't clearly explained, and the key factor that I can see amongst the papers that I'm about to show you is the type of music that has been listened to in the context. We don't know what it is. So how can we replay that piece of music in a clinical situation? Now, I have written a paper. I did a narrative review in music because a lot of papers that have been done are not quantitative. And really what I just wanted to do was find out what's been said in the literature about music and maternity care. And I found out quite a lot. And it was quite fascinating. And what I'm about to do is just show you the reference for that paper. I really enjoyed this literature review. And I was quite stunned about the fact that it seems to have so many positive effects, and I really feel we should be using it and measuring its effects more, because it seems to vastly improve people's experiences. So, to demonstrate to you, before I start and give you a little summary of some of the studies, I'm not going to go into detail on them, I'm really just going to summarise the effects. And I've been assured by the conference facilitators that this PowerPoint will be made available to people. And every paper I talk about will be referenced in this narrative literature review. So you can access the papers that I used as the foundation of this presentation. So what I'm going to do first is play you a piece of music. And this is a piece of music that in the West you might be quite familiar with. If you're in a Far East country or in the Middle East, you might find that you're not so familiar with it. But what I would like you to do, if you've got a bit of paper there, I know some of you might be in activities listening to this on your iPhone, but if you could listen to it and maybe jot down how this makes you feel. Okay, I know what effect that has on me, and I don't think it might help in an experiential situation. However, you know, if you've got young sons, they will lock themselves in the bedroom and really enjoy that type of music. It could arouse quite a lot of emotion and power. Now, in contrast, some of the messages that are coming up in the chat session box are fantastic. Don't like this, horrible. Sensory overload. Fascinating. Anyway, now I'm going to play another piece of music to you, And what I wouldn't mind getting some more of these chat session comments here because they're fantastic. Anyway, I'm going to play another piece of music and I wouldn't mind hearing your thoughts on this one. Okay, in the chat session room, the comments are completely different. I'm going to read some of them out to you. Relaxing, happy and chilled, restful for my brain after the last one. Ah, that's better. Smiley face, just lovely. Calming and relaxing. And somebody here has put in, I can't hear anything. What you need to do is go turn up your volume. Okay, so I think I've made my point. Now that latter piece of music is a piece of music that was designed for pain, treating pain. And apparently it is linked with the 5 notes of nature which resonate and have been demonstrated and proven to make people feel more relaxed. Now when we're talking about the papers, this is, I'm hoping, the genre of the type of music that was used in the studies. However, as I've said, there is not a lot of information about what the pieces of music were that were used in these studies, and I have recommended in my narrative review paper that we perhaps have a website and we post up when we actually have evaluated the effectiveness of papers, that we put the music into some virtual space, iCloud, where people can access it and use it. Okay, so why does music make people feel good? Well, people who listen to music they enjoy have been shown to experience increased levels of natural serotonin, a monoamine neurotransmitter that is used in the manufacture of some contemporary antidepressant medications. So what they're saying here is there's some biochemical reaction that happens that makes hormones release and basically stimulates people in a positive way. So music has been shown to have effects upon a variety of things, and I'm going to just go through a few of these. The first one is the effects of music upon a maternal stress and anxiety. Well, one of the first papers I looked at was by Ventura et al. In 2011, and I really summarised the key findings in it. This was a RCT that was done, and there was 154 people who took part, and they were awaiting having an amniocentesis. And all that was said about the music is that it was matched to the human heartbeat, was middle-low pitched, of low volume, and held a rhythmic, steady melody. And there was 3 groups of people. These 154 people were split into 3 groups, and group 1 experienced the music intervention for 30 minutes. Another group just read magazines, and a third group just sat quietly in a waiting room. And group 1, that was the music intervention group, experienced the largest decrease in cortisol levels and state anxiety according to scales and measuring equipment. And that is a p-value, a really good p-value of 0.001. So this paper has clearly shown that music has an effect on stress and anxiety. What I would like to see is more research done to increase the numbers and allow us to get a meta-analysis on this, and so we can actually demonstrate a little bit more vividly the effects of music. Okay, in the same topic, maternal stress and anxiety, this is a Taiwanese study done by Liu et al. Looked at the effects of music and anxiety levels during labour. 60 patients, or childbearing women as we call them in the UK, listened to the music intervention. Group 1 and Group 2 received routine care. And we used the smiley faces, the visual analogue scales, which has ethically been shown not to interfere too much with women when they're in labour. And as you see, they have lower anxiety levels in the latent phase between 2 and 4 centimetres dilatation, with no significant difference between groups observed during the active phase at 5 to 7 centimetres. But what this tells us is music is helpful in the first half of labour, the earlier components of labour. Okay, so music has also been shown to have an effect on depression. And Maritos et al. Has done a Cochrane review of 5 studies, and I picked this paper because it's encapsulating the work of 5 different studies. 4 studies reported reduced symptoms of depression in the music therapy groups compared with those who received standard care, and the music therapy was delivered across, a period of time and in certain doses. Depending on the different studies, that varied quite considerably. Upon questioning, participants viewed that the music therapy was an acceptable treatment for their depression. So they were enjoying it. They found it quite a pleasant therapy, and it's certainly quite non-invasive in terms of drug taking. So the conclusions of this is that, we need more numbers. There wasn't a lot of participants in these studies, and we need the studies to be very, very rigorous and need to be clear exactly what music affects what. Now, maternal mood is really key. In psychology, they say you can have 12 moods in one day, and you probably know that in a working day. You could start the day in a bad mood and then be in a good mood by 11, and then something happens and you're furious by 3, and so on and so forth. So mood is a very changeable event in the human psyche. So here comes music. Women come into the labour room scared, they come into the clinic worried, they can be anxious. And I don't really need to explain that to midwives because we know that. But Carolyn, who's an Irish researcher, looked at the experience of women who sang lullabies to their unborn and newborn babies. They sang 3 lullabies at least once a day prior to and post-birth. And what qualitative semi-structured interviews that evaluated their experiences found that 6 reported that singing lullabies was enjoyable, emotion-provoking, soothing and calming. So positive mood arousal affected by increased levels of dopamine produced in the ventral tegmental areas of the brain enhances endorphin release into the bloodstream and can make relationships better. So the effects of music on experiences of labour pain. In the UK we teach about Melzack and Wall's gate theory of pain relief, which is all about blocking nerve fibres by occupying them with other sensory modalities. And this is just one argument from what might be happening as well as in terms of hormonal releases. We don't really know these answers, and it would be more research would definitely help us understand more clearly what's going on. But it makes sense because reflexologists, massages, the TENS, transcutaneous nerve stimulator, all work through the gate theory and working with nerve fibres within the nervous system. Okay, so moving on to the effects of music on labour pain. And a slightly older study, but that doesn't mean to say that it's any less pertinent. The pain of labour is an unchangeable feast. And Hansler et al. Explored the effectiveness of music at decreasing 7 women, experiences of labour pain. They participated in 2 music therapy sessions 4 to 8 weeks prior to the expected date of delivery. The music intervention was played continuously for 10 contractions, sandwiched between equal lengths of silence. And all 7 participants experienced lower pain responses during the music intervention compared with the silent periods, using pain scales. And postnatal questionnaires confirmed that all participants retrospectively viewed the music programme positively. It was something that they enjoyed participating in and enjoyed having during labour, because that's key. If somebody's not enjoying listening to music or they want it switched off, it would need to be switched off. Fumda Dog and Good measured the impact of music on sensations and distress from pain experience during active phase of labour, 5 to 7 centimetres, in Thai primiparis women. So you see, a lot of these studies are quite international, and that's the second one that's come from the Far East. Group 1 listened to soft music without lyrics for 3 hours during early active phase of labour. Group 2 received routine care. And using visual analogue scales, or VAS scales, Group 1 reported significantly less pain and distress compared to the control group who did not listen to music. Lillebaelt et al. Measured effects of listening to soothing music upon women's pain experiences during latent phase, 2 to 4 centimetres. Group 1 listened to the music intervention for 30 minutes, and Group 2 control. Using visual analogue scales at 2 points, Group 1 participants reported reduced pain compared to the control group, with a significant difference of 0.05. So again, reinforcing that music may have an impact during labour on experiences of pain. Now, only one study out of 5 contradicted the benefits of music at reducing women's pain experiences during labour. And in this study by Kusal Art Jairia, please forgive me, I haven't pronounced that properly, found no significant difference between 3 groups of people, one that listened to Thai folk music, one listened to Thai classical music, and Group 3 listened to a no control music group. So this one is arguing against the effects of music, but 4 were saying that it has got an impact. So clearly we need more work done in this area. Okay, there was another whole branch to the effects of music in maternity care, and that is upon neonatal outcomes. And this work was really fascinating because a lot of it had been done by paediatricians. And I was blown away by this. And the thing that was stood out the most about the papers was they gave us a lot of outcome measures of benefits, but couldn't really explain why these benefits were occurring. And I think that is where music and measuring it and trying to work out what the actual impact is would be very, very helpful. But since embryologists have shown that there's a rudimentary earbud in the fetus at 3 weeks gestation, which is functional by 16 weeks, this means that the fetus is capable of active listening by week 24 gestation. And they can hear activities and hear what's going on. So here goes with some of the studies. Okay, effects of music upon neonatal outcomes. Most of these studies were done in special care baby units, as we call them in the UK, neonatal units, units where babies have been admitted with problems post-delivery. Now, Ira et al. Measured the effects of primiparis women listening to music during the antenatal period upon the Brazelton Neonatal Behavioural Assessment Scale, scores of which there's 7 clusters. Group 1 had listened to pre-recorded music cassettes for 1 hour immediately prior to sleep time, and Group 2 followed their usual bedtime routine. And what we found in this study upon reading was that on 5 of the Brazelton clusters, which are habituation, orientation, range of state, regulation of state and autonomic stability and motor performance, there was improvements in scores. You can go on the net and find out a bit more about Brazelton scores. It's really interesting, but there's masses of information about it on if you don't perhaps know much about that. It's something we use in the UK, but abroad you may not be so familiar with that system. Tabarro took a qualitative approach to explain the effects of music upon unborn infants and mothers. We listened to melodies from 5 months gestation. The cyclic melodies were continuously played during labour with a 30-minute break every 2 hours. Post-event, interviewees described that listening to the music reduced their levels of distress during labour, and no participant asked for the music to be discontinued during labour, which is key. It meant they were enjoying it, or liked it, or weren't noticing it. An explanation, a me-you relationship may become assembled between the musical piece and a retrospective viewing of the birth, when forged in the memory of the woman who recollects her birth with a distinctive song. And I think that links in beautifully with some foreign countries. For in Africa, women actually sing a song at the birth of their baby, and that song, in the Caribbean countries, in some, they sing that song to the child all through their life on their birthday, and they sing it at their funeral, which I think is actually quite beautiful. Bow and Callahan compared oxygen levels, heart rate and pain behaviour of neonates, and Group 1 performed non-nutritive sucking whilst listening to the music, and Group 2 were a no intervention control. Whilst blood samples were removed in a heel prick test, intervention significantly reduced neonatal heart rate, pain response behaviours, and improved their oxygen levels. Which is about relaxing babies when they're actually having these heel prick tests. They weren't done for the experiment. They were being done for routine O2 level testing, and during that period of time they played music. So it's got an impact on neonatals. Even though they can't communicate verbally, they're showing response behaviours physiologically in a positive way in response to music. Kane measured the effects of music on stress behaviours in terms of neonatal outcomes. Birth weight, calorific intake, and length of stay of stable preterm, low birth weight neonates in an intensive care unit. Now, Group 1 were exposed to 60 minutes of tape-recorded vocal music 3 times a day. Lullabies were played for 30 minutes, alternated with children's music for a further 30 minutes. In Group 2, the control were matched for sex, birth weight, and criticality of condition. That means that they had the same sorts of problems going on, like respiratory distress syndrome. The group were all matched. And music was shown, or found to, significantly reduce initial weight loss in the music group, increase their daily weight gain, increase their formula and calorific intake, which in turn reduced their length of stay in the unit and reduced their stress behaviours. So that's quite an accolade for the benefits of music. A very simple intervention in a neonatal unit. Keckenberg and Jensen et al. Studied the influence of music on the outcome of preterm infants aged 24 to 36 weeks gestation at birth. 61 participants. Group 1 received music therapy in kangaroo care, and Group 2 received kangaroo care alone. That's where the woman hugs her baby into her abdomen, skin to skin. A common treatment that we use for bonding in neonatal units in the UK and in other places. Group 1 had reduced pulse rate, slowed respiration, and increased transcutaneous oxygen saturation, and their blood pressures were stabilised. Again, an accolade for the use of music. Stanley et al. Meta-analysed validated overall large, significant and consistent effect size that music therapy improved neonatal outcomes. They improved higher rates of oxygen saturation on the meta-analysis of several studies. They stabilised blood pressure. Some of the studies I've mentioned will probably be included in this cohort. They moderated pain behaviours measured through observation of decreased arousal and facial grimaces, reduced stress behaviours, decreased duration of hospitalisation, increased daily weight gain, and increased nutritional intake. Okay, the relevance of all this for midwives is there quite clearly is potential for using music in maternity units. However, it needs to be researched more, and we need to convince our colleagues of the benefits and the effects. Also, the research that we've looked at in maternity care is really in its infancy. As I say, it hasn't lent itself to grant funding streams, which has caused researchers to steer away from it. The way I'm going to investigate it is get a PhD student, so if anyone is interested, contact me at Napier University. Midwives may implement music as daily part of their daily routine. It is ethical, cost-effective, it requires minimal effort, and it can be continued post-discharge. But what we do recommend is a music package and system requires to be developed, validated and trialled against specified outcomes and women's views assessed qualitatively. And then that package needs to be made available in all the maternity units with maybe some variety involved in terms of women's tastes. Of course, there's limitations of some of these studies, and I've touched on them already, and I have listed these in the PowerPoint. As my 20 minutes are nearly up, I'm not going to go over the limitations, but they are clearly in this PowerPoint. What I would like to finish up with is another lovely, relaxed piece of music, and I'm going to say goodbye. Thank you very much for giving me your time, and I hope this has been interesting for you. Goodbye. Okay, I'm willing to take any questions from anyone. If I can answer, I will. If I can, maybe you'll raise another issue which could come up from my research. So, you've written some lovely comments down the side here. It's really, thank you for the lovely comments.
Okay, Caroline. I know that a little bit further up there was a bit of a conversation about words with the music, and some people felt that it would be very distracting to have the words, but I sometimes I've found women that they like the words sometimes because they like that distraction. Has that come up in your research at all?
Do you know, this is the bit that hasn't, it's so, in all these studies, it's really, I couldn't access not one piece of music that was used. Apart from a couple that had used Beethoven or whatever, because you can then, you know what the music piece is about. But in general, whether there's lyrics or not lyrics, and I can see that. You've got a whole debate in there, but that would be fantastic for a trial, because you could have music with lyrics, and you could have music without lyrics, and you could try different types of music and then look at variables and then make these available. I agree, it could be distracting, it could be beneficial. Personally, I love music with poetry lyrics, when people tell their stories through music and so on. I don't know if being in labour that's the right time to have one of those stories, but maybe it would be. Some women sit and watch television while they're in labour, so that lends itself also to qualitative investigation, because women's stories of their experiences of music are also important. So there you go, that's a good variable. I never really had considered the thought of lyrics. I'd thought more about the power, like the first track that I played, the thrash metal track. which was called Power and Pain. You know, that's kind of what I would have associated it with. No lyrics in either. There's no lyrics in any of the songs that I'd actually picked. However, I myself am a massive John Martin fan, big on lyrics. You know, I love music, guitar music with lyrics attached, and a lot of my favourite bands have great lyrics.
And Helen was just saying here, yeah, she wondered if music without lyrics would be more beneficial during labour.
Perhaps that's right. And I know Helen. Helen's actually a friend of mine, so hello. Helen likes her rock music, you know. John Bon Jovi fan. So yeah,
Is that why she's shouting it then?
yeah, you know, well, she's as into music as me. That's the one thing that we have in common with each other, you know, apart from sharing the same star sign. Yes, I think it could be distracting. I think it could be, but maybe distraction's great. If you're about to have an amniocentesis or an external cephalic version, maybe distraction's great. You know, in psychology, you have an attention capacitator, and if you're going to steal 30% of that, you're taking that attention away from pain experience. Perhaps.
Mm. And Becky asks, is there any information on the effects of music on midwives?
Yes, I've actually done a little myself a little peer review, you know, because I initially got interested in this, as I said, when I was at Salford University. I've just started in Napier about 3 months ago, and I asked my peers and people what they thought about it, and I got a full variance of responses. Some were going, gosh, that's a great concept and it's free, ranging right across to how awful I couldn't bear to be with a woman in labour that wanted to listen to, you know, such and such, you know, particularly, you know, somebody's leaning might be rock music, you know, maybe the midwife wouldn't enjoy that. But then again, I always think as a midwife, it's not about you, it's about the client. And I think, you know, there's lots of things we do that might not be ideal for us, but it should be always about the woman's experience. You know, so you know that if you're with one woman one day who's listening to music you don't like, you probably aren't going to get that for a while again. So I don't know. That'd be a nice study to do. I just did it as a, you know, a question and answer to see how interested people were. Obviously, the music department were extremely interested, and others just didn't see it as important. Others saw it as really very valuable, you know. So I got the full range of responses, you know.
And Layla, she talks about using music for pain relief, but also the Quran for hypnobirth.
Yes.
Have you heard of that?
I haven't, no, but I don't see why that shouldn't work. If you're, you know, the Quran's really important to you. But I tell you what I haven't mentioned in here, which is really, really key. I lived in China for a short while, and the Buddhist monks sing the Om, you know, Om Mani Padme Hum, and you can buy lots of CDs of Om music, and I listen to it a lot in the office at work because it's so invasive while I'm writing or doing work, and it creates a beautiful atmosphere which I love working in. And the Buddhist monks have intuitively known that the Oms, which are the notes of nature, because that's what they resonate on, are really, really helpful for them to meditate and go into a deep relaxation state, which is what they spend a lot of their time doing. So the Quran, I don't know if it would work in the same way as that. The Oms are being researched in the Far East, and personally, I love them. And I only got into them because got interested in the music project, and I now own 5 Om CDs. One of them is of Buddhist monks actually chanting. So probably maybe the same effect as the Quran. I can't answer because I'm not really familiar with the Quran, but there's another group, you know, another group variable, and particularly if you're in the Middle East, that might be very important to you, you know, where the majority of people are from that belief system.
And she goes on to say that when they listen to it, they concentrate on the meaning and its rhythm as well. So that's similar to the Oms.
Yes, yeah, yep. Is there a question in there, Sarah? I'm
And everybody really likes your accent.
Oh, that's nice, thank you. You know, I'm a Scot. Yeah, some foreigners often think you're Swedish or Dutch speaking English when you've got a Scottish accent. Actually,
And the
all
women were
right.
usually... Oh, there you go.
I've been asked about the CDs, where I got my CDs. Okay,
Oh,
I
yeah.
can tell you, you can get them on the net. You can get them on the net, the OM CDs. You can get them on the net. I bought mine in Hebden Bridge. I've been living in Hebden Bridge for the last 4 years. And there's a lovely spiritual shop there that sells lots of Buddhas and OM music, and they play it a lot in the shop. That's where I bought mine, but you can buy them on the net. There's a lovely comment here about a child being a lovely singer at 2 years old. You know, there's recognition of music would be interesting as well. You know, if you play music while a child's in utero, you know, is it attracted to that kind of music post-delivery?
Oh, yes. I think it was Linda that put that comment up.
That I really, that would make a fantastic study. You know, because you know what they say about in fetal medicine, you know, children that have been from stressed uterine life, you know, with a stressed mother, that affects their anxiety levels post, you know, in their childhood, which is quite a sensational response to intrauterine life and its variables. But I mean, that's a tenuous link there, but nonetheless, it could still be connected in some way.
Mm. Okay, does anybody have any other questions? And Layla's put a link for you, saying please look at my patient in Iran TV shown Water Birth and Hypnobirth by the Quran.
Mm-hmm. Right, lovely. Yeah, that's good. That's good. Yeah, I'll actually access that myself and have a look because that's another valuable connection. So it's been helpful for me, this too. It's raised quite a few questions, you know, that you could embed into studies.
Okay, well, thank you, Caroline. I think that was a wonderful presentation, and I think we all really loved the music, especially the one that we finished off with. So thank you so very much for your lovely presentation and the wonderful discussion that we've got going. I think we've all learnt a lot. So thank you very much, and I'll be
Thank you.
closing the meeting.
Yeah, thank you, Sarah. It's been nice to talk and meet you. Goodbye to everyone, and thank you for listening.